Good afternoon. My name is Jeff Chipman, and as chair of CancerCare Manitoba Board of Directors, I can tell you that it is a real pleasure for us to be holding this forum in Brandon, Manitoba today. The board and committee members, as well as management from CancerCare Manitoba, all arrived in Brandon this morning, and we're all pleased to be here to be part of this great annual event. I am also here with Dr. Navaratnam, President and CEO of CancerCare Manitoba, who will be presenting later this morning. Thank you for welcoming us and hosting us here today. I welcome you all to the CancerCare Manitoba Board Annual Public Forum for 2022. Whether if you are here in the lecture theater or joining us virtually from our CancerCare Manitoba sites, or all across our province, welcome. At our board meetings, we normally start with a land acknowledgement, but as I'm aware that Minister Gordon will also be doing this morning in her presentation, I'm going to pass on doing what ours, because I believe hers will be much more eloquent and I think says things even better than what we try and do at our board meetings for every month. Also joining us here this morning, or this afternoon now, is Brian Schoenbart, who is the CEO of Prairie Mountain Health, and also from the Western Manitoba Cancer Center, Dr. Sylvanathan, radiation oncologist, as well as Dr. Anderson, medical oncologist, who is our newest physician here in Brandon. As I mentioned earlier, we will also be hearing from the Honorable Minister Audrey Gordon. We have an exciting and informative agenda that includes an update on CancerCare Manitoba Board and a presentation from Dr. Navaratnam. We will also have a question and answer period at the end. This will be your opportunity to engage with us. For those of you who are joining virtually, you can submit your questions by using the question and answer tab in the Zoom application. Please feel free to send your questions as they come to mind throughout the presentations. We will try to respond to as many questions as possible within our allocated time. At this time, we'll hear from the Honorable Audrey Gordon, Minister of Health, who has sent us greetings virtually on behalf of the province of Manitoba.
Good afternoon, everyone. As Minister of Health, I'm pleased to bring greetings on behalf of the province of Manitoba to CancerCare Manitoba Board's annual public forum. We recognize that Manitoba is on the treaty territories and ancestral lands of the Anishinaabe, Anishinaabe, Dakota Oyate, Denisoulane, and Nihotowa peoples. We acknowledge Manitoba is located on the homeland of the Red River Métis. We acknowledge Northern Manitoba includes lands that were and are the ancestral lands of the Inuit. We respect the spirit and intent of treaties and treaty making, and we remain committed to working in partnership with First Nations, Inuit, and Métis people in the spirit of truth, reconciliation, and collaboration. Thank you to Jeffrey Chipman, Board Chair of CancerCare Manitoba, for the gracious invitation to bring greetings. My thanks as well to everyone involved with organizing today's event, and of course to all of you participating both in person and virtually. Today's public forum will surely be informative and educational. I'd like to take this opportunity to express my appreciation to a few parties today. First, I want to acknowledge and honor everyone who's a cancer survivor or is fighting cancer right now. I commend the courage and strength of those affected by cancer, and I applaud the families, friends, and supporters who help and care for their loved ones. Through those struggles and those emotional and physical challenges of cancer treatment, you have been there for your loved ones. Secondly, I'd like to commend all cancer care workers and volunteers for their continued compassion and initiative, especially during the challenging times of the COVID-19 pandemic. Your dedication and commitment to care is honorable. I applaud you all for providing quality care, support, and protection to some of our most vulnerable citizens and their caregivers. Finally, I commend CancerCare Manitoba for the vital role it plays in cancer prevention, treatment, care, research, and education. CancerCare's continued leadership and action to reducing the incidence of cancer, to reducing the likelihood of dying from cancer, and to improving the quality of life for those affected by this disease is truly worthy of honor today and every day. As part of Manitoba's overall health system transformation and to further enhance cancer services for patients from across Western Manitoba, our government has partnered with CancerCare Manitoba, and we are going to expand and renovate the Western Manitoba Cancer Centre. This will include a 7,000 square foot expansion, which will provide additional exam rooms, treatment spaces, and a new medical linear accelerator for delivering radiation treatments. I understand you will be touring the Western Manitoba Cancer Care Centre today, and I'm confident that you will appreciate the breadth of high-quality services it will offer to Manitobans in Brandon and surrounding communities once the expansion is complete. The province of Manitoba looks forward to continuing our work with CancerCare Manitoba and our many partners across the province and across Canada as we work to improve the health, safety, and well-being of all Manitobans. Thank you and enjoy today's forum.
Thank you. Dr. Ratnam.
Hi, I'm Srinav Ratnam, President and CEO of CancerCare Manitoba. I really like to thank our Honorable Minister. I think she gave very greetings and all the information that we are going to share today. So that was, it's very nice to hear how familiar they are with all the work that we do as CancerCare Manitoba and with our partners. So what I'm going to do is to kind of highlight some of the work that we have done this year, which is more relevant to Western Manitoba Cancer Centre. Can I have my slides, please? Maybe I have messed up the program here. Brian, I'm supposed to introduce you, not talk. My apologies, my apologies. So we are here in Brandon in the Prairie Mountain Health Region. So we have to hear from Brian Scumbot, the CEO of Prairie Mountain Health Region. And I really, at this time, I really wanted to thank Brian for his leadership to the Prairie Mountain region and to WMCC, because the WMCC is between CancerCare Manitoba and the Prairie Mountain Health Region. So our partnership is very strong and we really want to grow. So here you go. So you have to sit down, Brian.
Thank you so much, Dr. Navaratnam, and thank you, Mr. Chipman, today too, for inviting me. It's such an honor to be here, and it's such an honor to have you all present with us today here in Brandon, and welcome. I want to extend a very, very warm welcome. I just want to say a few things. I'm not as tall as maybe some of the others, but taller. Approach. First of all, Prairie Mountain Health and CancerCare Manitoba have had such an excellent relationship, and we have worked very, very closely together. And we certainly honor that relationship. And I just want to say we look forward to all the additional work and expansions that are coming up. It is very, very exciting, not just for Prairie Mountain Health, but for a very large area that it serves. It really does bring our services closer to home. And we all know how much it means for those that are going through cancer and what all the additional travel might mean to them too, just an additional worry and burden. So this means a lot to the residents of this area, and we just want to thank you very much for bringing the services closer to home. Of course, we are excited about the expansions. I think the expansions, the direction they're going, it's broadening them. And also, I believe expanding them where they need to be. And we even look forward to the expansions that might happen in the future. And I just want to recognize and say thank you for thinking of us. Thank you for thinking that we can indeed provide these services. And I know there's much to talk about into the future. But I think I want to thank CancerCare just overall for all the work you do in our province. As a cancer survivor myself, I know exactly what you provide and how you provide it, more importantly. It is a very caring organization. You have the patient at the center of your business, which I can't say more about it, but thank you for what you do. And for all the dedication and support you're giving, not only to your patients, but to the families that walk along with them in their journey. So thank you very much.
Thank you, Brian. And as you said, thank you for those kind words. And also our partnership will grow, needs to grow. So thank you for that. So we talked about WMCC, or Western Manitoba Cancer Center, and the expansion. And without the healthcare providers, whether oncologists or nurses, and all the other radiation therapists, medical physicists, we cannot have WMCC. So I like to take this opportunity for all the staff at WMCC for being here. And today you're going to hear from two of the oncologists. One is Dr. Goklan Sivanandan, who is the radiation oncologist. We heard from Dr. Bill Hunter, who was in the last time. So we have two radiation oncologists here. And very recently, we added a medical oncologist. So we are really expanding. And I hope we could have a hematologist and another medical oncologist soon joining us. So it is very important that we support these physicians who have selected to come and serve the community here. So Dr. Sivanandan, the radiation oncologist.
Okay, good afternoon. I'm Dr. Goklan Sivanandan, radiation oncologist at the Western Manitoba Cancer Center. Thank you for the opportunity to address the group and speak with you today. I've been practicing in Brandon for 4 years now. Being born and bred in Winnipegger myself, there was a lot for me to learn about the region and the patients in it. For starters, Prairie Mountain Health Region has a catchment of nearly 180,000 people. That's about 13% of the population of Manitoba. But at the WMCC, we also provide radiotherapy to patients from other health regions as well, including Southern Health, Northern Health, as well as parts of Eastern Saskatchewan. The next slide, please. There are some unique patient perspectives that need to be considered for our health region. For example, I've learned that there are specific times of year that I simply cannot ask a farmer to commit to 6 weeks of radiotherapy to his prostate, specifically seeding and harvest. I have also learned that some patients will avoid going into Winnipeg at all costs, and in some cases that is to their detriment. Next slide, please. I have learned that there are some remarkable strengths of working in a smaller center. For example, as a specialist, most physicians in the region know who I am, and subsequently several of them have me on their speed dial. I will often field quick questions from family physicians and hospitalists, whether it's convenient for me or not. Of course, in turn, I also have a lot of physicians on my speed dial and can often phone a friend to facilitate efficient and timely care for my patients. One of the most crucial things I've learned is the importance of the team around you. And let me tell you, the team we have at WMCC is second to none. Our nurse and clerical staffing model is different from CCMB, as both nurses and clerks rotate through different departments. For example, nurses in the radiation oncology clinic will rotate between the clinics of myself and Dr. Hunter, but also spend time in the chemotherapy room. This creates a cohort of team players that can step into any role required of them. This has proven to be especially crucial as we continue to provide care through the COVID-19 pandemic. Next, oh, no, go back, please. The WMCC Radiation Therapy Department consists of therapists, technologists, and a physics associate. We did previously have a physicist, but he relocated, and we're currently hoping to recruit. Our department is small, but it is mighty. The size of it, with less moving parts, allows for much more agility and flexibility. Having all team members working in close proximity allows us to troubleshoot and adjust patients' care path quickly and efficiently. For example, a patient can have diagnostic imaging confirming a spinal cord compression, be assessed in my clinic, have CT simulation and treatment all occur on the same day. This is especially important for frail and elderly patients who are traveling long distances to see us. Again, the strength and mettle of our team was tested during the height of the lockdown as we continue to deliver necessary treatment without interruption, including for COVID-19 positive patients. Next slide, please. To continue to provide standard of care treatment at the WMCC, we will have to grow with the growing need. So we are, of course, extremely excited for the upcoming expansions. A new radiotherapy bunker with a new linear accelerator will not only provide an upgrade for our aging machine, but gives us the opportunity to expand to a multi-linac center in the future. Next slide, please. But first on the horizon is a new clinical suite. This will provide much needed space to see and assess our ever-expanding patient population, not only by the current cohort of oncologists and GPOs, but also for the new additions to the clinical team. Our newest addition, who I don't see in the room yet because he's probably still working clinic because we had him hit the ground running. Our newest addition to the Western Manitoba Cancer Center team is Dr. Brady Anderson. I was going to take this opportunity to introduce him. If he times this perfectly, he'll walk in the door right now. Dr. Anderson received his Doctor of Medicine and Bachelor of Science in Medicine from the University of Manitoba. He completed his internal medicine and medical oncology fellowship at the University of Manitoba as well. He's joined us at the WMCC as the sole medical oncologist about 6 weeks ago. I did some digging and I found an article about Dr. Anderson published in the Reston Recorder, which was his hometown paper. It's dated August 7th, 2015. So at that time, he would have finished his medical school and was starting his internal medicine residency. He's quoted to say, "In 2020, I should be practicing medicine independently as an oncologist in Southwest Manitoba." So while his timing might have been a little bit off, his prediction did come true. And so we're certainly happy that it did and thrilled to have him join us at the WMCC family. Unfortunately, he didn't time it well. I thought it was going to work out so well, but it didn't. Hopefully he can join us once his clinic is over. Thank you so much.
Well, so Brian, thanks very much for attending and your warm words of welcome. And you know, again, we know how important the relationship is, and everyone at CancerCare is going to do what we can to make sure it just continues to grow. Doctor, great presentation. Really, just personally, just to find out more of what's going on here. I think it's so important for our board to hear this firsthand. So I'm so glad we all came here. And now before I start on, now I'm just going to introduce Dr. Anderson. So I hope you're ready to your presentation. Because you're up. You're up.
All right. Well, sorry about that. I am still quite new, as you know. You don't want to look at my belly? So new enough, I still take a few wrong turns. So thanks for inviting me today. This is the 6th week that I've been out working in Brandon, and still thrilled to be out here. So at this point, I was thinking last night on my way home what to say today, and it kind of struck me, and a little bit of a tear to my eye, that I grew up living in Southwest Manitoba, and going through several family members with cancer, and the extra work that it took to take them to Winnipeg and seek care further away from home. That I may not change the final outcome, but I can provide a little bit more peace and reassurance to friends and families just like mine. There you go. So we're all going to pretend it looks like that outside right now, and not that it's going to look like that soon.
Oh, no.
And I took over my aunt's season tickets for the Brandon Wheat Kings, and just thought, now this is the sixth decade that we've held the tickets to the family. So we won't talk about last night's game. Perhaps I'll sit in the seats when we win a game at home. But it's something that I've thoroughly enjoyed, being back in Southwest Manitoba, getting reconnected with the community, and looking forward, hopefully next summer, to exploring a bit more in Riding Mountain, getting out and exploring the huge region that we have, and seeing everything that we have to offer. I threw in a picture of this. This is the grain elevator in Elva, Manitoba. We were actually building our house. We were getting reclaimed timber for our mantle from this, but unfortunately during the dismantling phase, this happened. But the good news is our timber got out before that. So we've got a little bit of Southwest Manitoba heritage, always at home on the mantle. So unfortunately, I'm so new, I didn't really have many photo stock images of any of us at the clinic. So I'm very excited to be working with a number of great nurses, support staff, and annoying the hell out of Kathy. So at this point, I don't want to take up everyone else's time. And again, thanks for everyone coming out today.
Well, thank you, Dr. Anderson, and I know I am sure everyone is so pleased to have you be in the health region and being part of CancerCare Manitoba. And one thing we do know is you're the only one here doing what you're doing, and our organization and our board, and I know Dr. Navratnam's plans are to try and make sure you've got somebody who could fill in for you when you do want to maybe go up to Riding Mountain and spend some time outside. So that is a goal of ours, to try and continue to add to the abilities to provide cancer care and services here in the Prairie Mountain Range region. Sorry. Before our presentation from Dr. Navratnam, I'd like to just provide a brief board report. Since its establishment in 1930, CancerCare Manitoba has been dedicated to clinical, academic, and operational excellence by enhancing the quality of life for Manitobans living with cancer and blood disorders. The new Health System Governance and Accountability Act, passed into law by the Manitoba Legislature on July 1st of this year, 2022, designated CancerCare Manitoba as Manitoba's Cancer Authority. As the provincial cancer authority, CancerCare Manitoba will continue to deliver vital health services to all Manitobans. The organization is responsible for setting strategic priorities and long-term planning for cancer care and blood disorders, for providing the delivery of cancer services related to prevention, diagnosis, treatment, and care. These are all in accordance with the Provincial Clinical and Preventative Services Plan. CCMB's mandate also includes the responsibility to carry out cancer research and to provide the public cancer education to the people of Manitoba. We are currently working with Manitoba Health in establishing the new governance structure and authority. As per the provisions of the new Health System Governance and Accountability Act, CancerCare Manitoba has executed an accountability agreement with the Minister of Health. We believe this to be an important step in the continued improvement to transform and strengthen our healthcare system to better meet the needs of all Manitobans. The CancerCare Manitoba Board now consists of 11 members who are appointed in accordance with the Act. Part of this new structure is to have 4 board members from outside the Winnipeg Capital Region. As our board currently has 2 board members, we are starting the recruitment of 2 additional members who will be from outside the Winnipeg Capital Region. The board is committed in seeking skill-based candidates who embody values associated with equity, diversity, and inclusion, and the nuances, differences, and similarities of the communities that we serve. The board holds 10 regular meetings per year. Governance by the board includes receiving various documents, reports, and recommendations for information and approval. Annually, we receive and approve the risk management report, strategic plan, annual progress report, which is available on the CancerCare Manitoba website, and proposed budget that is submitted to the Minister of Health and Government. Annually, we also receive documents as the construction report, building security report, audited financial statements, workplace safety and health reports. Monthly, the board receives a special presentation and report from the President, from CancerCare Manitoba programs and department heads, board committee minutes, an update of governance topics, and approves privileges for new physicians joining CancerCare Manitoba. The board meeting minutes are all available to the public on the CancerCare Manitoba website. As a board, we have a number of committees to which members are appointed. Committee membership also includes community representation. The board has a finance and audit committee, community connections, and executive, facilities and planning development, quality and patient safety, and a new research committee, which is focused on the new CancerCare Manitoba Research Institute. We also, part of the board, have the advisory medical committee chair, who is invited to attend all board meetings to provide such information, reports, and advice as requested by the board. The CancerCare Board of Directors is also responsible for the oversight of the strategic vision and planning for CancerCare Manitoba. CancerCare Manitoba has made progress on a multi-year capital project designated to address its immediate needs and to strengthen and stabilize cancer services into the future. We continue to work in partnership with Shared Health and the Transformation Management Office on a variety of capital projects that impact cancer services both inside and outside the Winnipeg Capital Region. Dr. Navratnam will be speaking further to this in her presentation. CancerCare Manitoba is committed to provide care that is patient and community-centered, for all Manitobans, regardless of race, ethnicity, geography, social economic status, age, or gender identity. As a board, we acknowledge the continuing challenges of racism in the health system. And as a board, we are committed to provide equitable cancer services for all Manitobans. CancerCare Manitoba voluntarily participates in the Accreditation Canada's Q-Mentham accreditation program. The Q-Mentham program is a 4-year cycle of assessment and improvement, which helps organizations assess all aspects of their operations, from board and leadership, care and services, to infrastructure. This assessment evaluates performance against national standards. The last 2 accreditation surveys took place in 2015 and then again in 2014, both with exemplary standings on both occasions. This is the highest level of performance achievable. CancerCare Manitoba is preparing for the next on-site survey next year, November 2023. Well into 2022, the COVID-19 pandemic continued to be a challenge for everyone. I'd like to acknowledge and thank Dr. Navratnam for her leadership, the executive team, and every single healthcare provider at CancerCare Manitoba for their amazing efforts that ensured that cancer services for patients continued throughout the pandemic. At this point in time, we feel that we are in post-pandemic recovery phase. CancerCare Manitoba remains watchful and protective of its current environments for safety of patients and staff. At this time, it's my pleasure to introduce back again Dr. Navratnam, President and CEO of CancerCare Manitoba. Dr. Navratnam has been in this role since 2014, and as a board, we are grateful for her strong leadership and vision, not only for CancerCare Manitoba, but for cancer control and cancer research throughout the entire province, as well as nationally and globally. Please, Dr. Navratnam.
Thank you, Mr. Chipman. Thank you for those kind words. Now I have my first slide, please. First of all, I'd like to thank the board and the board members here for your support and commitment to the province. And, you know, coming here itself, it shows how supportive our board is understanding our mandate of serving the province. So my sincere thanks to the board, board chair and the board members. Next slide, please. Next is the commitment to Manitobans. You heard from the minister to Jeff and Brady talked about how committed we are to the people of Manitoba. And I know, as Brian said, CancerCare Manitoba really being graded very high in that, but we could do more. We could do more to Manitobans. So our commitment is always there. Next slide, please. I was told not to turn back. There is a slide there. So our commitment, it starts with, you know, I always say, we don't start a day without written on a piece of paper. The same way we have this roadmap. We have the plan. This is not a strategic plan for CancerCare Manitoba. This is a plan for the province, how we could control cancer, or cancer control plan. This was created with the lens of, through the transformation lens and the CPSP, Clinical Preventative Service Plan of the province. So this is the roadmap that cancer control, that all the regions, and including the Clinical and Preventative Service Plan of Shared Health, needs to use as a foundational document. And this cannot happen just by us doing the work. Each one of the public to the universities to the health regions all has to take part in to have a best cancer control. Next slide, please. So we are in a very beautiful province with a very diverse culture, with 18% of First Nations, Métis and Inuit, and also some disadvantages or disadvantaged communities in the sense, poor socioeconomic status. So it's a very, very diverse community, is Manitoba. So unless we understand the community, we cannot provide best cancer control. That's what the roadmap drives for patient and community-centered cancer care. So cancer is given in the community, so we need to understand that. And Jeff has already touched on racism and health equity, but I just wanted to again to say that equity, diversity, and inclusion is very important for CancerCare Manitoba. You know, I say that when somebody walks through our door with the diagnosis with the cancer, such a burden, emotionally and physically. On top of it, if that person gets discriminated, it is totally unfair. The same way with the staff as well. If they are discriminated, how are they going to provide the their best to the patient. So EDI or equity, diversity, and inclusion is very important part of our culture to bring health equity. Next slide, please. So going back to the roadmap, we have 6 priorities. I'm not going to talk about these priorities. I spoke in the last year when we started. This was in effect from 2021. As I spoke again, this is not just CancerCare Manitoba to own. It needs to be owned by everyone. And I was very pleased that every region has invited me to speak in their strategic planning to include these priorities. And the progress that we made on the first year is in the annual progress report, is already available on the website. So I'm not going to go into that. The next one, please. Next slide. So what I wanted to talk about is what is for Manitobans as a population. So our CancerCare Manitoba is a leading comprehensive cancer center for Manitobans. And it could become the leading comprehensive cancer center nationally and internationally. That's what we all have to march along and work towards. Next slide, please. And I'm very pleased with the Bill 10, which Jeff spoke about, this giving us that edge further for us to become that comprehensive cancer center in Manitoba. I mean, I have kind of highlighted 3 things. Cancer Authority Strategic and Operational Plan, which I already talked about as the roadmap and CPSP and all that. The second one this Bill 10 gives us is as a Cancer Authority, we are going to be responsible for cancer standards. We were doing as CancerCare Manitoba informally, but now this gives us this formal authority to bring standards. And I always say, you know, a person getting a surgery for colon cancer in Thompson should not get any less quality surgery as compared to Winnipeg and the other way. So the quality surgery or quality cancer care is a very important part of our mission. So I'm very pleased that Bill 10 addresses that. And finally, research. Research and innovation is a driver to bring best cancer control. Again, very pleased CancerCare Manitoba is being given that responsibility to do cancer research. And, you know, I was just going to point out that a scientist from the Brandon University is here in the audience again, that this is not research Winnipeg-centric. This has to be Manitoba-centric. And I always say, when we talk about clinical trials, we want every Manitoban should be able to have access to clinical trials. So this is the standards. We have already worked in our way with regards to standards, but you will see more updates on this end of this year. Next slide, please. And I already talked about research, and then research is something that has been there from the beginning of cancer care. The first name that was given to cancer care was Cancer Relief and Research Institute. Those people were in 1930s were so visionary how important research is for cancer control. And next slide, please. And we have grown into CancerCare Manitoba Research Institute under the sole governance of this board. So again, this talks about care through discovery. We want to bring the research more closer to people's care. And as I said earlier, not just the people accessing clinical trials in Winnipeg, but throughout the province. The next thing is infrastructure expansion. I'm not going to talk about all that, just focusing on Brandon, which has been touched on by everyone today. Next slide, please. And you know, this is deliver timely access to quality care closer to home. This is something CancerCare Manitoba has been doing for decades through the community cancer programs, but that is being elevated or consolidated more now with this transformation for us. So which is again another advantage or that we need to leverage on. Next slide, please. I'm going fast because of the mindful of the time. So just focusing on WMCC, Western Manitoba Cancer Center, that there has been identified as a provincial hub, intermediate hub. So outside the McCharles site of CancerCare Manitoba site, we have 4 sites in Winnipeg. This is the only one which has the radiation machine. So this is a second site in Winnipeg, which has the radiation, which gives that status of intermediate site. And we don't want to stop with that. We wanted to expand to, when I talked about comprehensive cancer center, which is research, high quality care, and also hope and healing. Do we have time to go through this video, Ingrid? Okay. So I wanted to share the story of Tammy, that what we are talking about. Please, you start playing.
When we found out, I can still remember that moment. And actually, when I walked in here today, I felt it.
It's been 8 years since Tammy Mayer was diagnosed with breast cancer stage 2B.
It was heartbreaking because I knew nobody with breast cancer. I had no breast cancer in my family. I was fit and healthy. I had these great kids, this incredible career where I traveled the world, and bang, I had breast cancer.
It was found accidentally. Mayer says she went to the doctor for a bump on her shoulder and a mammogram was suggested.
The little lump on the shoulder was nothing. It was just a little cyst that they removed, but I always call it my guardian angel on my shoulder because it helped me to find that breast cancer early.
She was 44 years old.
I took a few days and cried, and my family cried, and we told our close friends, and then we just decided, and family, okay, I'm a go-getter, I'm a take-charge person, and I said, let's take control of this.
Taking control meant calling CancerCare Manitoba to see about services for patients and their families. There were many for women with breast or gynecological cancers.
And so the last thing I wanted to do was wake up 10 years later and be dealing with the stress and trauma of not dealing with my cancer diagnosis. So we did it all.
Mayer did individual couples and family counseling. She visited the wig room. She attended every class she could and joined a young women with cancer group. Resources she found at the Breast and Gynae Cancer Center of Hope.
Not only is it physically tough, emotionally it's devastating. So I feel that in using all of those resources, it's really what helped me get through the journey.
Lorena Garrell says the Center for Hope opened 25 years ago just for breast cancer patients and expanded later to include other women's cancers.
We want to take the learnings and build on that incredible foundation work that was done by so many stakeholders in the breast cancer community. And we want to now be able to expand that and offer that same type of information, education, support to people living with any type of cancer.
Garrell says the upcoming expansion is important because more than 7,000 Manitobans will be diagnosed with cancer this year, and each one has a lot to learn during an already taxing time. She says research shows having good evidence-based information, support services, and wellness programming makes a difference.
You're going to understand your cancer better and the decisions that are facing you, and you're overall going to be able to live a better life.
A decision Mayer made was to join a Dragon Boat team made up of breast cancer survivors called Chemo Savvy.
I saw a pamphlet at CancerCare and I thought, this is interesting, a bunch of active ladies who, like me, have battled this monster and they're still active and enjoying life.
Mayer is now the team's president.
And for me, it's helping young women that get diagnosed with breast cancer. It's mentoring them. It's having discussions with them. It's taking an active board role as president for my organization so that I'm actually continuing to give back because these ladies inspire me.
Her involvement is something she learned at CancerCare, where she says so much was given to her.
Because the gift that I got when I went through, I feel I need to give that back.
Thank you. So the purpose to play this slide is, or the video is, we wanted every Manitobans to have the same experience. So we are very fortunate in Western Manitoba Cancer Center that we are going to have a center for hope, so that the people could benefit. It doesn't need to be confined to that. We will be planning lots of virtual programs so that, it is not just the physical building, but it also going to provide services to Manitobans virtually as well. So these are some of those renderings that we are hoping that we will see, and very aspirational. Next slide, please. This is not possible without the philanthropy and the generous donors, generosity of Manitobans. So this weekend we had this Guardian Angel 2022, and so my sincere gratitude to the Manitobans. Through CancerCare Manitoba Foundation, we were able to do this. So my, again, this is one of the same, like Tammy, somebody standing beside me has really used our services and who really brought tears to me that day when I met her at the gala. And the next to that is the organizers and the CEO of the foundation. So before I conclude, I really like to thank all the healthcare providers and the staff. When I say staff, it's not just CancerCare Manitoba staff, all the staff in the health system who care for cancer patients. And I do say CancerCare Manitoba spend less money than all the other regions together on cancer patients because of the hospital admissions and all that. So everyone, we all have to get together to make it better cancer control in the province. So this is not going to, as I said, this is team and the members is all health system and the people of Manitoba has to work together. Next slide, please. That's for the question and answer. Jeff? We have 10 minutes.
Okay. Right over here. Well, thank you very much, Sri. Great presentation, and as always, you always inspire everyone to do more for what we can for the people of our province. Before we move on to our question and answer period, I would just like to want to take a quick opportunity to acknowledge an organization that's so critical to what we try, what CancerCare Manitoba does, is the CancerCare Manitoba Foundation. Its president, Patty Smith, as well as their past chair, Steve Croft, as well as their current foundation chair, Lee Mahar. We're so grateful for all the amazing work they do in supporting all the programs and everything we do at CancerCare Manitoba. And we need to thank all Manitobans for the support that they show in everything that the foundation does to raise funds to make our province a better place to live and better for people who go through their own personal cancer journeys. At this time, I think we're going to get into a question and answer period. We've got some time to do so. If we run out of time to answer your question, you can email us at the end of the forum. The email address is going to come up on the screen. And if you send us an email on that, we will ensure that we'll respond to you. I see that Dr. Donna Turner is now on the screen, and I'm assuming live and we can hear her. So if so, Dr. Turner, is there any questions there that you might have for us?
Yes, and so just so folks are aware that if you are in the room, Dr. Navaratnam and Mr. Chipman and I are going to take turns. I'll be reading some of the questions that are coming in online in the Q&A. So for those of you that are online, we encourage you to submit those. And then we'll be swapping back and forth to see if there's any questions from the room. So the first question, Dr. Navaratnam, you have said that progress has been made in the strategic priorities of the roadmap that was outlined in 2020. What do you feel is your biggest success, or even we'll give you the top 3 successes that have happened so far in the following the roadmap?
It's an excellent question, and it's outlined in the, as I said, annual progress report, but just to say it 3, the priority 6, which is the priority of cancer control for First Nation, Métis, and Inuit. When we talked about it and put it up there as the priority, I was somewhat, I wouldn't use the word pessimistic, but I wasn't sure how much progress we are going to make. But in that 1 year, the level of engagement we had with the community leaders like Southern Chief Organizations, MKOs. So we have made significant progress there. So I would say that is one of the highlights. And the second one I'm going to say, I'm going to keep the fingers crossed, because we're going to present the lung cancer screening to submitting the proposal to the government. And so at least we have come to that level with the green light. So that is still close to my heart, because that's how I started my career with this, treating lung cancer. And still, again, when you look at the low socioeconomic groups and that's a very common cancer. So I think that would be the second one. And the third one, I would say, in how we have progressed with standards. And, whether it is NAPRO standards, that is a whole provincial initiative. But when we look at the systemic therapy program, we have initiated a systemic therapy program. We are publishing the second standards for surgical standards So I think those are the three, I will say it. Thank you.
All right, that's great. And just so that folks know, we have several comments in the chat coming in. So if let me know if there are questions from the floor. Otherwise, I have several very good questions here that are coming in from people.
I don't see any hands from the floor, so you could ask the next question.
All right, all right. So we discussed about the Centers for Hope and how that is planned. And the question is, when are the expansions set to happen for the Centers for Hope? Is there a deadline?
So good question, but because I went fast, I wanted to clarify it. So the Center for Hope, it's a concept, and we want every Manitobans to get that, the program, whether it's a yoga or whether it is art therapy or whether rehabilitation, physical rehabilitation, management of pain and all that. So it's a program, and then we will have few centers in the province. That's the idea. And those will be the hub to coordinate this one. So we're going to get the Brandon one is going to be the new, the most closest that's going to happen. And if I remember, Brent, you could answer it, but I think tender is out there for construction, right? Tender is out, I think it went out. So we will, that timeline is going well. Probably, when is the opening? Do you know, the opening?
They've been opened already and they're.
No, what I meant is the hope, the shovel will go in the ground and opening. I think 2023, 2024.
Yeah, I think
2024, so that's the timeline.
Right.
And when it comes to Winnipeg, we are trying to create something in the existing MacCharles. And as everyone knows, we didn't get the second building yet. So we are trying to modify and get something in there. But we need much more than that footprint in Winnipeg. So.
And just sorry,
Yes.
but, and just on the Brandon thing, that the foundation has been working very closely with a donor who's identified the new Brandon, the Center for Hope for Brandon, and looking forward to some announcements coming, not this year, early in the new year, about some funding for that program and the facility.
Thank you, Jeff, for bringing that up. So we are not there to announce it, but I'm very thankful for that philanthropy and the donor. Thank you.
All right, thank you. So there's also the next question that's come in is around treatment. And as many of us are aware, there's a lot of new treatments that are being developed. When is Canada, and maybe Manitoba specifically, going to have proton therapy available for cancer treatment?
So the plan for Canada is going really well. I cannot, because of the national tables and CAPCA involvement, I'm saying that. So that's going to happen soon. I cannot give you exactly the date. The green light is there. So Canada is going to have it soon. But Manitoba, but very interestingly, we are doing this HSC planning, campus planning. That means in Winnipeg, there is an HSC, which is a Health Sciences Center, University, and CancerCare Manitoba. We're all in the same campus. So in that planning, in the next phase, not now the first building, the next one, the proton treatment has been included. Consultants were very excited having that. So Canada, we will get it soon.
All right, thank you very much. And so this is a question that may be more for Mr. Chipman. It's a question around the seeking of the public board members. So the question is, are you currently seeking additional public board members for CancerCare Manitoba? And if so, what's the process?
Great question. I can tell you, as I said in my presentation, that we are ongoing discussions with Manitoba Health right now in finalizing the new governance structure for CancerCare Manitoba. So we've embraced components of that. One of them is our board membership. But we've also submitted a very thorough document to them regarding the continuation of some of our existing board members and their terms, et cetera. So we are awaiting a response to that, which we would expect to be before sometime in November, and we're hopefully to be able to finalize sort of that understanding of how our governance is going to work. So then to answer your question, I would think we would start the process, and we're going to probably do it publicly, and the final decision is made by the minister, but it is our plan really to take the initiative to identify the people who have an interest and have the skill sets and fit with and can be an asset for our board, probably early in the new year. So I would think that may take a few months process. So by the early in 2023, we would hope to be able to add these members to our board.
All right, thank you very much. So I know we have 1 minute left. I have a couple more questions, but I'm going to try to fit in just one, and it has to do with special populations. And the question is as you know, in Manitoba, the newcomer population is growing rapidly. Do you have any special plans to address their needs?
So we do have underserved population program under community oncology, and we have identified 3 priorities in that. One is First Nations, Métis, and Inuit priority 6 of the roadmap. That's the group kind of coordinate that. And the second one has been the elderly, and because 40% of the people are over 70, so we needed an elderly program, and also for adolescent and young adults, AYA. Those 2 are going well. And so we have the next, so I would say next to First Nations, Métis, and Inuit, the next one is the newcomers, which we saw it during COVID, how vulnerable they are. So we have, I have Ruth Lowen in this room here, and we have those really addressing that. And we have actually submitted a grant to CPAC, Canadian Partnership Against Cancer, to work on with those communities, similar to how to address screening. Prevention is mainly in screening, and also when they come for treatment. When they come for treatment, not able to understand the language, sometimes children translate, and it's such a difficult problem. So it's an excellent question. And I think if I remember correctly, in 2 weeks, the program is going to come and present it to me, the plan for the next 1 year. I saw it in my calendar. So yes, that is a key priority, and it became very obvious during COVID.
All right. We do have a couple more questions, but I'm aware that we're at the top of the hour. So I am going to suggest that we could put those questions online as part of our follow-up to this meeting, thinking that you'll be wanting to close the session.
Okay. Well, thank you, Donna. Thanks for handling this for us. So unfortunately, our time has come to an end. I want to thank you all again for participating in the CancerCare Manitoba Board Annual Public Forum. I want to thank Brian again for your welcoming words and having us come to the great city of Brandon to do this. Also, I want to thank Ms. Kathy Ward, who is the manager of the Western Manitoba Cancer Center, and Ms. Laura Bossert, who's the regional lead for communications for Prairie Mountain Health, for assisting in all the logistics of this. And we were trying to organize all this, and we were nervous about trying to do things publicly as well as virtually, but I hopefully they've worked out. And I want to thank everyone here for doing all that, as well as all the staff at CancerCare Manitoba for all the background work and work they did in organizing all this. So thanks again, everyone, and I look forward to doing this again next year and seeing all of you. So thank you and good afternoon. Now, question is, are we offline? Well, let's just get off camera just in case.
Brady, that was very nice. You brought your I don't want to be, that's its medicine, right? That's its medicine. That's the means of go.